Health services consist of medical professionals, organizations, and ancillary healthcare workers who provide medical care to those in need. Health services serve patients, families, communities, and populations. They cover an emergency, preventive, rehabilitative, long-term, hospital, diagnostic, primary, palliative, and home care. These services are centered around making health care accessible, high quality, and patient-centered. Many different types of care providers are necessary to offer successful health services. Health services are often connected to healthcare. This program aims to appraise the health conditions of individuals through screenings, examinations, cure and treat disorders, prevent and control the spread of diseases, provide safety and emergency care, and first aid, and to ensure a follow-up program for individuals who have undergone treatment. Health appraisal. Grade 7 Week 8 First Quarter. Health is a form of wealth. To be healthy, one must be aware of one's own health state through frequent health checkups and screening procedures. Adolescence, ages 10 to 19, is a time of rapid development. As well as development adolescents, particularly those in school, children are subjected to a physical examination and a screening test by the school's medical staff. The DOE ensures access to quality health care and services in an adolescent-friendly environment through directives such as the Department of Health's DOE Administrative Order 34A, S. 2000 created the Adolescent and Youth Health Subprogram under the Children's Health Cluster of the Family Health Office. Health services cover many different types of medical issues. Many people think of primary care, outpatient care, and emergency care when they need an illness managed or are generally not feeling well. Include mental health care, dental care, preventive care, laboratory and diagnostic care, and nutritional support. The Department of Education also has school medical, nursing, and dental services. Weight is defined as the heaviness or lightness of a person and may mean the weight of a person's body. It is important to get the accurate weight of growing up teens to assess whether a child is growing well or growing thin due to malnutrition or other factors. Weighing beyond the normal weight may mean that the child is overnourished, which may also affect the child's health. Height is the measurement from base to top or from feet to head of a standing person. It is the distance between the feet on the floor to the top of a person's head. Accurate measurement of height and weight is important in monitoring one's health. Both are needed to calculate the body mass index when tracking development in growth during the teenage years. Height measurement can be done individually or with a partner for more accurate results. A tape measure, ruler or book and pencil are used to measure a person's height. It is also best to perform the said activity with your back against a flat wall. A medical equipment that gives a more accurate measure is a stadiometer. Medical exam or physical exam is a routine test wherein the pediatrician or a family doctor may feel or listen to the different parts of a person's body to keep track of changes in one's physical health, check for medical conditions or possible diseases, and/or determine whether further tests are required. A medical record must be filled out by the patient with his or her parent, guardian, which includes the name of patient, gender, age, address, weight and height. The doctor then examines the patient's skin color, breathing and pulse rate using a 6 stethoscope, and blood pressure, among others. The doctor may also ask about other medical complaints that a patient may have experienced prior to the visit. After examining the patient, a doctor may give vitamins as supplement or advise other tests to ensure the patient's optimum health and well-being. Breast self-exam or regularly examining your breasts on your own can help adolescents check any irregularities that might need medical attention in the future. It can be an important way to find a breast cancer early. Develop the habit of doing breast self-exam monthly. It is advised that since there are normal changes that occur during or before menstruation, perform the BSE preferably right after menstruation. Scoliosis is a deformity of the spine, where the spine curves to the side, often with an S-shaped or C-shaped curve. It commonly occurs when young teens experience a growth spurt just before puberty. However, the condition can appear at any age. There are no data yet regarding scoliosis in the Philippines, according to DOH, but Dr. Oliveros, together with his team and Amanda Bonife-Quiamco, a scoliosis awareness advocate who founded Scoliosis Philippines, are pushing for the children's initial screening for scoliosis in schools to be mandatory from 6th grade to 8th grade. Hearing like vision. Hearing is important to cognitive growth. Hearing is important to speech and language development, communication and literacy. It is necessary therefore to allow children to go through an audiology evaluation while growing up to avoid hearing loss. 12.5% of kids between the ages of 6 and 19 have hearing loss as a result of listening to loud music at unsafe volumes through the use of earphones, according to the Journal of Pediatrics. Loss of the ability to hear during childhood can be congenital, delayed onset, acquired or progressive in nature. In some cases, a mild hearing loss cannot normally be identified through a routine hearing screening. An audiometer is used by an audiologist to determine a person's hearing sensitivity at different frequencies. There are other hearing tests as well, e.g., Weber test and Rinne test. Dental checkup. Teenagers are advised to visit the dentist at least twice a year, to prevent gingivitis, cavities, plaque buildup and to take care of their pearly white teeth. The following may be examined during your visit to the dentist. Assess your overall oral health and hygiene. Assess your risk of tooth decay, root decay, and gum or bone disease. Evaluate your need for tooth restoration or replacement. Remove stains or deposits on your teeth. Check your bite and jaw for problems. Dental or oral health must be maintained at its optimum to avoid damage to gums and teeth brought about by unhealthy eating habits such as eating junk foods and carbonated drinks. In athletic tournaments, dental records also help in identifying the student's chronological age. Health services may include mental health care, dental care, preventive care, laboratory and diagnostic care, and nutritional support. The Department of Education also has school medical, nursing, and dental services. Health services contribute to the goals of the education system and healthcare system by providing screenings, referrals, administering medications and treatments, providing first aid, providing health counseling and education, and supporting students to acquire self-management skills.